Flashcards suck. Every lecture, hundreds of new cards, thousands of impossible Latin names, and by the time you finish, the first 80% already forgotten. Poof. All that work just disappears. How can we allow aspiring medical practitioners to reduce this memory decay? Flashcards cannot provide deep enough learning for a field as vast and complicated as medicine. Memory is best retained with a network of neural connections to existing topics, so even if the brain blanks out, you know the tracks to that lost point knowledge. Knowledge, and specifically medicine, is about connected reasoning, not isolated facts. With no tailored solution for medical students to visualize their learning, they are unable to make those neural connections and have little other solution than stupid flashcards. This is why we created HippoTree. Meet HippoTree, a real-time AI patient simulator designed to bridge that gap. HippoTree gives students practical, repeatable, and measurable clinical practice with instant structured feedback. With HippoTree, medical students can finally algorithmically track and visualize their learning. Through practicing real presentations, essentially diagnosing patients, this process is recorded on the side in a flowchart, so an algorithmic way of thinking induces deeper learning. AI is integrated into HippoTree by both mimicking patients and being an all-knowing library and guide throughout your diagnosis. HippoTree's Persona AI lets you practice against different roles. Want a difficult patient? Choose a guarded persona. Want to test your theory? Choose a logic mode without any personality flair. Want to test explanation skills? Select a questioning student persona. There are plenty of personas to choose from that help reinforce memory retention. At the heart of HippoTree is an algorithmic flowchart that grows with the conversation. As you ask questions, the system maps connections between symptoms, questions, and responses in this chart with two major suggestions help to hint and trigger thinking, driving the diagnosis further when you are stuck. After sessions, HippoTree acts like a clinical coach. It reviews your flow of questioning, much like a chess engine analyzes moves, and offers concrete feedback. Which questions strengthened the diagnostic case, which avenues were missed, and how to improve future interviews. HippoTree tracks your progress over time. It measures clinical reasoning, short-term memory retention, and question effectiveness. The system uses these metrics to personalize future sessions, focusing practice on weak areas and reinforcing stronger habits. HippoTree turns passive study into active, evidence-driven practice. Students graduate with better questioning technique, sharper diagnostic reasoning, and a visual record of their clinical thought process. Train smarter, reason better, prepare for real patients with HippoTree.